and link to our own workshop. My apologies.
No problem.
Is that working?
Looks great.
Fantastic.
All right. So thanks everyone for joining our January workshop. Kicking off the new year with an extremely exciting topic. We're going to be talking about healthcare's patient engagement journey, and Libby Hoy, who is founder and CEO of PFCC Partners, will be guiding us through the journey and highlighting some milestones. We'll have some time for reflections on the past 10 years of healthcare's patient engagement journey as well through our hour together. I'm Lindsay Galley. I'm the Director of Education at PFCC Partners, and happy to kick us off today. So if we go to the next slide, I just have some tips for using Zoom. If you are using your computer for Zoom and you have some background noise, you can find the mute button by hovering over your screen and finding the toolbar. There you can find the mute button. You can also find your start and stop video button if you would like to show us your lovely smiling faces like we are. You should also see the presentation on your screen, and then we'll have lots of time for chat conversations throughout our hour together today. So you can also find the chat box there on that toolbar as well. I see a lot of people have already found the chat and are introducing themselves, so thank you all for doing that. We have a quick poll as another way to introduce yourself and share what your role in healthcare is. So I'm going to give Laura Jackson, who is the office administrator from PFCC Partners, just a minute to bring up the poll. So you should see the poll right now, and you can choose multiple answers if you are a patient family advisor and also a patient family caregiver, or if you have multiple roles, you can decide or make your choice right now. And if you have a different position than one that you see on the screen, please feel free to chat those in. And click submit. And so, Laura, once we have a good number of responses, I think we can share the results. Wonderful. So we have lots of patient family caregivers and patient family advisors joining us today. I see a good amount of patient family advisory program facilitators, leadership. So it looks like we have a really good representation all across the board, and I really appreciate all of you joining us today. Please, again, throughout the time, please chat in and share your experiences, share your reflections of how far healthcare has come with patient engagement throughout the past 10 years, and some of your predictions for the future. Really interested to hear from all of you as well. All right, so PFCC Partners, that is our organization, and we are a small but mighty team that recognizes that the quality of healthcare outcomes is really improved when we partner the expertise of healthcare providers with patients and families. And that is from bedside in the clinical relationship to boardroom with patient-family advisors, partnering on quality improvement projects and supporting healthcare organizations at a really high level, all partnering to design policies, programs, and care plans for the best possible outcomes. So Libby is going to talk a lot today about how we put this vision into practice. And this is our team. A lot of them are, I think everybody is on our workshop today, and some have introduced themselves in the chat. So if you ever need anything, feel free to reach out. But this is who we are, and you can see our smiling faces here. And with that, I'm going to pass it off to Libby Hoy to kick off our workshop today.
Thank you so much, Lindsay. And can you hear me okay? My audio?
Yep. Sounds great.
Excellent, excellent. So First of all, just this slide is really amazing because I started 10 years ago at my kitchen table talking to myself. So this is incredible that we have a team, and beyond the team that you see here on the screen, we also have a wonderful community of advisors that support our efforts, that partner with us. We have faculty members and an ever-expanding group of resourceful and energized people around implementing patient and family-centered care. So getting ready for this workshop today was such a great opportunity for me to really think back about my humble beginnings and into this work and where we got started. But more importantly, it's really an opportunity for me to express my gratitude to everyone on the call that we've had the opportunity to partner with, those of you who are joining us for the first time and who we'll look forward to partnering with in the future, and a lot of early folks that really supported the evolution of patient and family-centered care partners. At the top of my list are those 5 folks you saw on the last slide. I'm really appreciative of a staff who is innovative, who is energetic, and really is so mission-driven to make space for every patient, every family caregiver to participate fully in their own care and in the design of the health system. So just to sort of go back around my own journey, I really started as a family caregiver in the 80s when as a teenager, I became primary caregiver for my mom while she battled breast cancer. Shortly, a couple of years after she passed away, I had my own family and have 3 amazing, incredible sons who live with mitochondrial dysfunction. So between the 3 of them, they've had, I think we're at 36 surgeries in 13 different hospitals, thousands of hours of physical therapy, occupational therapy, speech therapy, emergency room visits, you name it, we're that high-end user of the healthcare system. And it really started to evolve my thinking when the boys were going through the health system about what a team approach to care could really mean for their outcomes. And then finally in 2016 with my own diagnosis of stage 3 salivary gland cancer and neck dissection surgery followed by concurrent chemo and radiation, my journey personally through the health system is what I have to inform the health system. That's really what where my expertise lies. And so I thought it was really interesting how my own journey sort of reflects the journey of the US health system to move from, in the 80s when I was taking care of my mom, we did a lot of things to patients and families. We didn't really ask if they wanted that. We didn't really ask how that lined up with their goals or priorities. And I remember my mom saying to me early on, the isolation she felt being a cancer patient was the most difficult thing for her to deal with. She was such a family person. I was the youngest of 9 children, and so her family was so critically important to her, and the way that the healthcare was delivered to her made her isolated from all that was really important to her, and that was really a tough way to go. When my sons were born in the early 90s, the health system was shifting towards doing more and recognizing the patient and the family caregiver as end users in the healthcare system. We really implemented the HCAP scores and started to attend to looking at the patient experience within the health system. And that really started to open the possibilities of real partnership with patients and families, and moving to a point where in my own cancer journey in 2016, I really felt like I was doing with our clinical team. So my surgeon was asking me what was most important to me, and she was reminding me of those priorities as we went through the difficult bumps that we had to go through together ahead. I remember sitting in the infusion room and getting my, I think it was 2nd or 3rd dose of chemotherapy, and I asked to see the bag that was being hung, the IV, and the nurse said, it showed it to me, and then she said, you know what, we do 2 safety checks on every bag of chemo to make sure we're getting the right chemo to the right person, why wouldn't we just have the person do the third check and just as an added safety? And that to me just resembled such a shift in thinking to when I would ask what medications were being put into my son's IVs, and often being met with, I know what I'm doing kind of attitude. This progression of partnership, I think, really follows my own story. So um, I am grateful to be part of the evolution. So PFCC Partners, again, was started 10 years ago. I can't believe it's been 10 years. And it was really, again, a product of my own family's experience and also my emerging experience in the role of patient family advisor. I had joined my kids' children's hospital advisory council in the mid-90s, which was long before we really knew a lot about the high value and integral role that patients and families could play in healthcare design. So we started as a hospital membership organization. Again, driven by my own sort of experience, I thought healthcare was hospitals, and I equated the two. Really just didn't have a full perspective of all that enters into the creating the health system. So I started as a health hospital membership organization, which was not a super great model because there just wasn't a lot of motivation at that time and limited resources. Every hospital struggles under the limited resources and competing priorities as pain points. And so when we discovered Center for Medicaid Medicare Services and the quality improvement programs that they were funding, that was a very big shift for PFCC Partners into rather than working with one hospital directly, we had the opportunity through programs like the Quality Improvement Organizations and the Hospital Improvement Innovation Networks. We had some opportunities to work with groups of hospitals and health systems, and it really started to expand our thinking about how the hospital relates to the larger health system, how many different kinds of hospitals there are across the country. And so that really, again, expanded our thinking and put us in a position to contract and partner with several independent groups in an ever-expanding landscape of groups that wanted to leverage the strategy of engaging the patient-family perspective in their work. About 2012, we launched the PFA network, although I'll very humbly say it was more of a stumble over the start line than it was a launch. There were 12 of us, and in no small part to the efforts of Tara Bristol Rouse and Erica Steed and others early in the PFA network history, we've really built upon that. So you'll hear a little bit more about that in a few minutes. And to the newest milestone, really thinking without limitation to the partnerships and the potential for partnerships of all stakeholders across the health system, whether that be the health delivery system or policymakers, measure developers, and how do we get to a person-centered measurement, really to payers, to health insurers and community organizations. So again, really expanding our vision. So I told Lindsay I wanted to call this slide, wait, what? Because I was just totally shocked by these things being true. I thought that every hospital team of leadership would want to embed person and family centered care. Why wouldn't they? That just made perfect sense to me. I of course didn't have the hindrance of needing to worry about budgets or sustainabilities or clinical staff or anything else. I thought no budget would be required. You know, we would just go forth on the best of intent, and again, knowing it was the right thing to do. Why would we need money? I realized early on, with the help of some clinicians that I partnered with early, I remember saying, well, we should just go get a grant and we'll just do this as a grant. And Dr. Mark Robertson, really smart guy, said, if you do it as a grant, it'll end when the grant is done. If you work into the central budgets of the organization, you'll have sustainability and the organization will really utilize this partnership. Shock there too. I thought every staff member would be excited to contribute to this time, to embed patient and family advisors, regardless of the fact that they had overflowing plates filled with responsibilities. Why wouldn't they be excited as I was about this work? I thought everyone I talked to understood the core concepts of patient-family-centered care. I didn't think I had to actually explain anything. I thought that was just, everybody got it, right? And finally, I thought the EMR was going to be the solution to getting patients and families access to their own records, to their own care. And I just had a couple of assumptions that were unraveled for me, sometimes gently and sometimes not so gently, in those first few years. So I had a lot of learning to do, a lot of learning to do. I learned what the phrase "meet people where they are" really meant. I thought, that's groovy, I really want to do that philosophically, but it actually means doing that geographically, and it means understanding fully what our partners, our clinical partners, our administrative partners, our policy partners, what things are they're grappling with, that it's not always as easy and straightforward as it looks, maybe on the surface. I understood the value of language to create community, that if we were all using the same language, that we could move the mountain faster than if we were all diluting the environment with different definitions and different ways of speaking to this partnership. The value of having some consistent language to anchor those conversations was huge. And we all owe a debt of gratitude to Bev Johnson and the Institute for Patient Family Centered Care for their work in defining what is person family centered care. Everyone, and I say this all the time, everyone, all of my wonderful colleagues who work in the area of patient family centered care, nobody is arguing that the core concepts that Bev put forward 25 years ago are still the right core concepts. So really utilizing that consistency. Speaking to inclusion, I grew up in Long Beach, California, in Los Angeles County. Diversity and inclusion have been part of my upbringing, it's part of my fabric, but I didn't realize that wasn't the case all the way across the country. So I had to articulate inclusion. I learned to evaluate everything. I could only improve things if I knew how badly I had messed them up in the first place. So evaluating every piece. Taking a quality improvement approach, I think that was one of the biggest learnings I've had in this work, is we're on a journey and we're still at the beginning of the journey. And so taking a quality improvement approach meant it relieved me of the responsibility to have it absolutely right. It meant I could learn with everybody else who was on the journey with me. And so that has been key to, central to the way that we work. Being intentional, really thinking through what are our goals in any given partnership and how do we get there. I've learned the value of evidence. Apparently, not everybody is as excited about this stuff as I am. And so for those who I can't just beg and ponder and prod into agreement, evidence really gives us a sound, solid foundation. And I not only understand more about our own goals because of the evidence, but I also understand the relevance and need and central desire for evidence from a lot of our partners. And then finally, I learned a need for fellowship. I thought I had some great ideas. I'm not going to lie. When I opened in 2010, I really thought I had some great ideas. And then I realized there are a lot of people out there with some really great ideas. And when I started as an advisor, I felt like my children's hospital was the only one doing this stuff. And I realized that there are so many others across the country. And so this need for fellowship, this need to share with others who have experienced the health system in similar ways to my family, coming together and really harnessing the power of that voice.
Libby, speaking of fellowship, there's lots of good conversation going on in the chat. I put a
Oh,
question
great.
out there about assumptions, and if others on today had similar assumptions, and definitely all in the same boat. But Greg Merritt brought up another one that totally missed the power of inertia and the challenge for
Ah,
change, which,
nice.
yeah, he says, I assumed once someone said they agreed, that then things would change, which doesn't always happen, which is a really good point, Greg.
It really is. It expands your thinking to the supports for that change and how we can sustain
Mhm.
it. Awesome.
Exactly. Yeah. And
Awesome.
Libby, I also had a question because there is so much that you have learned over the years since
Yeah,
starting
one slide was really not enough.
not enough, but since starting at your kitchen table, I'm curious, what was one thing that surprised you the most during those early days of getting PFCC Partners up and running?
I think the value of infrastructure. So I led with a passion and all the best of intent. I really wanted to make space for every patient, every family member. But I missed the idea of infrastructure and how do we support that partnership so that the patient family perspective moves from a program or an initiative to a valuable strategy for improving outcomes, whether those outcomes are for myself or my family member, or whether those outcomes are for the hospital or the health system overall. So I think that need for infrastructure has really it's really demonstrated when through gateways and other efforts that we've made, when we really focus on creating a sound foundation and infrastructure, those programs are sustaining year after year after year and growing. They have a solid foundation to grow from. So I think, yeah, infrastructure for sure.
Right.
So where have we gotten to now? The current PFCC Partners strategy really builds from the perspective we each have as patient family advisors ourselves. So each of our team members still participate in the role of patient family advisors, using our lived experience to really inform whatever project we're working on. So you see a number of our projects there in the gray box. That's not a comprehensive um, list by any means, but uh, the other portion of that is the PFA network. It's critical to us to stay in touch with patients and families who are partnering on the front lines in hospital PFACs and health systems, in research teams, so that we understand and can stay in contact with the emerging needs of the community of advisors, as well as the community of the health system partners who are trying to implement effective patient-family engagement structures. So we really kind of think of ourselves as having a foundation in the advisory role and continuing to have sort of two customers, if you will, although we don't really see it that way, two areas of partnership, one being the professional health systems and the other being the advisors. The more we lift up the bigger advisory community, the more effective partnerships we're going to have as well. So these are, in the blue box you see there, some of the programs we've had the great opportunity to work inside and really develop the patient family advisory community for those programs. So I've been talking about person and family centered care and patient family engagement and being mindful of my language. I just want to level set the way that we at PFCC Partners look at those terms. We think of patient and family centered care as the model of care, or the noun, if you will. And so with that in mind, we think of, again, patient family engagement, or engaging the perspective of people in the health system. We look at that as an active strategy. It's the verb of how we build the person-centered system. We can't build a system for patients. We want to build it with patients and families, so it's very effective. Um, and so patient-family engagement as a strategy then can be layered on to whatever folks are working on, whether that's a research project or a quality improvement project or patient satisfaction scores or quality reducing hospital-acquired infections. It becomes this strategy that can be implemented across the board, as well as in our own clinical relationships, right? When I'm engaged with my healthcare team, then our outcomes are better. And if you look at my children, you can see clearly we have experienced better outcomes because we were able to inform our healthcare care planning and decision making. That's not to say we said, you know, we've got this right and we follow it. No, no, no. We were able to contribute initially our family's priorities, and then the boys for themselves contribute their own priorities for their outcomes in combination with the expertise we so relied on in the health system. So we also, at this point, kind of look at a balanced approach to partnership, being that engaging the patient-family perspective in advisory programs means it will be implemented at the clinical relationship. One without the other is unsustainable. We have to write policies that support engagement in the clinical relationship, and as well, we have to look at that engagement at the clinical relationship to be sure that those policies are correct and right and valuable to all patients and families. So I also, because I have become a fan of linguistics and really acknowledge that people call patient-family advisors, what we use as that term, many, many different terms: patient partners, family partners, advisors, advocates, but subject matter experts, the whole list. What we're talking about, and all of those are very valuable and all of those are in play. What we're really talking about is people. You and I who have experienced the healthcare system, using that lived experience to influence the healthcare system of the future. And that really is an encompassing term. So you'll hear Lindsay and I use the term advisor through this presentation, but no, we are inclusive of all of these folks. Lindsay, do you want to talk a little bit about the evolution of the role of patient-family advisor?
Yeah, sure. Thanks, Libby. So as I introduced myself earlier, I'm the Director of Education here at PFCC Partners, and have had the honor and privilege of helping skills exchanges of patient-family advisors from all across the country. And over the years, we have really seen that role evolve. We've seen it evolve from the monthly meetings of attending patient family advisory council meetings to now
Uh-oh.
family advisors on their board of directors. It's a huge evolution, and we're really excited to be a part of that. But some of the lessons learned along the way is to engage as advisors early and often. I'm still continuing to encourage the healthcare organizations that we partner with to consider involving advisors from the start, from the research phase, from the gathering data phases of any project. And then the infrastructure that Libby talked about is so, so important. We'll talk more about that as we continue, but that infrastructure and having that set in place, and advisors as an integral part of the organization has continued to evolve, and we see healthcare organizations really taking that on. And then setting expectations for both the healthcare organizations and for the patient family advisors is so important to do from the beginning, so everyone has a really even understanding and equal understanding of what that role is. I know when we start off with some healthcare organizations, we see a little bit of fear from staff because they have an opposite assumption from what we discussed, and that patient family advisors are going to come in and just tell us everything that we did wrong. And that's not something that patient family advisors, that's not really part of our role. It's coming to these partnerships in a collaborative manner where we really want to help the organization improve. And then that active strategy, patient family advisors, patient family engagement is that active strategy to improve healthcare outcomes. And on the next slide, we have a really good example of that active strategy.
You know what, before you get to that, Lindsay, I just wanted to make mention of the graphic on the left.
Oh, yes.
Those are the core competencies of patient-family advisors, and those were generated by advisors. So you'll see that all over our website and the PFA network, but the point of the PFA network is to be generated by the community, and so I just really wanted to call that out and thank all of those on who contributed to those.
Mhm. I can't believe I skipped right past them. I talk about core competencies so much.
Quite all right.
So going back to patient-family engagement as that active strategy for improvement, we always encourage hospitals or healthcare organizations who are engaging with patient-family advisors to align patient-family advisor activities to the strategic goals of their organization. So this is a great example from a patient-family advisory council in Los Angeles County that we supported the development of. And they had their organization has and continues to have a strategic goal to improve access and improve utilization of their My Wellness portal or their patient portal. And so, as the patient family advisory councils have developed over the last year in Los Angeles County, which we'll talk a little bit more about shortly, they saw this great resource and strategy to involve the patient family advisory councils in improving the access and utilization of the portals. So, at this particular advisory council, the members talked about how they use the portal or how they don't use the portal and what challenges are in their way for accessing the portal or what helped them in accessing the portal. And with the advisory council and the organization, they were able to work together with an interdisciplinary team, health IT team members and staff, to brainstorm and co-design specific activities that will increase My Wellness portal access. So having one iPad and a staff person available in the waiting rooms to help sign people up and show them how to use the portal, and a few other activities as well. But you can see that active strategy to co-designing a program or a policy that in turn really supports improvement of their strategic goals.
Thank you, Lindsay.
Of course.
So how do we build these?
We build these through the Gateways to Patient Family Engagement program. This is really our strategy for developing patient family advisory councils, and it comes in many forms. We have a 6-month learning collaborative where we walk teams through the 5 steps that you can see on your screen: setting the table or creating the infrastructure for an advisory council or an advisory program to be integrated into an organization. We talk about recruitment, orientation, what information do the advisors need to participate effectively and partner effectively with the organization. We also talk about launching first meetings with advisors and sustainability practices. So I mentioned we have a 6-month learning collaborative where we've walked a lot, hundreds. I've lost track of how many teams we've walked through the learning collaboratives. And we've also pared it down to a 1.5-day boot camp that we do in person so we can meet people where they are. And we've been able to bring the Gateways program to rural hospitals who do have limited resources and don't have the time to spend 6 months with us. So it's a proven program that we know has worked, and a lot of coaching comes along with that as well. But this is really our structure and strategy for developing patient family advisor programs.
Thank you, Lindsay.
Thank you.
And you may have picked up on Lindsay's language in saying patient family advisory programs. We're really understanding the evolution again of these partnerships. So they don't always look like patient family advisory councils anymore. They don't all follow the once a month sort of meeting, and we're really adjusting to that and figuring out new ways for patients and families to have their perspective at the table. The other piece of this in thinking ahead is figuring out what formats we need to create that don't exist today that will engage a larger diversity of our populations. We're still within our advisory efforts not diverse enough, and so that's part of it. But you can see for a given organization, whether that be a hospital or a health center, or whether that be a research team or a quality improvement team, there's many different ways to engage the patient and family perspective in that work, and we want to acknowledge that and grow, again, but always implementing the infrastructure that supports that partnership regardless of the format. So I mentioned evidence a little bit earlier. You can only get so far with enthusiasm. And we have really seen over the last 10 years an emergence of evidence. Doesn't mean that we're there, certainly, but we are starting to see, and we really have the Institute of Medicine to thank for that, and the landmark paper, Crossing the Quality Chasm, which listed person-centered health system as a way to address patient safety and harm. So we still have much work to do in this area, but we have a lot more to stand on now than we have had in the past, certainly. So where are we today? These are some of the great opportunities PFCC Partners has had to partner with health systems and with patient family advisors. We are growing. We're growing in numbers. We're growing in diversity. We're growing in age. We've got an age span now. We've got abilities, lifestyle span. We are growing, but we have more to do, certainly. In recent years, we've been expanding that partnership, again, just kind of really thinking outside the hospital box into health systems and what drives health systems. We've had so much activity with partnership in research, thanks to Patient-Centered Outcomes Research Institute, who also incidentally got started 10 years ago, and revolutionized the idea that patients and families could not just be the subjects of research, but really could be valuable resources to developing even the research agenda, as well as research uh, strategies and dissemination efforts. We've moved into quality improvement, working with the quality improvement organizations and that CMS program. And now we're moving into measure development. I would say this is a newer partnership, and we're still figuring out sort of how to do that. That'll be in the next section on the future look. But we have some early wins in this area in partnership as well. So we've really seen the expansion of patient family advisory programs outside the hospital walls and into all of these other health system activities. And I'm sure many of you could add more, policy, others, and I would love to see that in the chat box as well. Our PFCC Partners implementation strategy experience includes we've had such wonderful opportunities to really think differently and innovatively about how we bring the patient-family voice into traditionally activities that were not really available to them. So I think this is not an exhaustive list, but I think this includes some of what I would consider our highlights, our biggest opportunities for learning, and maybe our biggest sources of pride. The top of that, the National Coordinating Center, the QuinnQIO work, and the 11th scope of work, which went from 2014 to 15 or 14 to 2019, just ended. The quality improvement organizations, for those of you who aren't familiar, there's one in every state, and this is a program that's funded by the Center for Medicaid Medicare Services to ensure that we're continually improving the healthcare system for Medicare beneficiaries. But as a result of the fact that the Medicare system is the largest payer in the country for healthcare, they often influence the healthcare system overall. So this was really an opportunity to have patients and families in each of the states or each of the regions sitting side by side with these quality improvement innovators. Oh my gosh, these people are smart. To really think about what would benefit patients and families across the country and in those specific regions. PFCC Partners had the privilege of developing the infrastructure, and with the all-in spirit of the National Coordinating Center team at Telegen, really implemented 22 patient beneficiary family advisory programs, which were sustained across the lifespan of the scope of work and still continue in the form of the Quality Medicare Advisory Community. So again, im- implementing engagement on a national structure, on a national program was really an exciting opportunity. The HIN work, the next one with Comagine Health, or formerly Health Insight, and HSAG, was an opportunity to target the hospitals in a quality improvement program also from the Center for Medicaid Medicare Services, as was the Transforming Clinical Practice Initiative, where we worked with locally, being in the state of California, with Pacific Business Group on Health and LA Care as leaders in transforming the ambulatory health system in and the primary care system in California. These were all areas of, programs I had no concept of when I started out and was really focused on hospitals. But these quality improvement initiatives are such a great vehicle and such a resource to our health system in continually improving. I look forward to the 12th scope of work, or the next iteration of these programs, to roll out very soon. We need these programs. The work that they have accomplished in the 11th scope must be continued into the future so that we ensure we don't backslide in any of these critical safety areas. We had the privilege of working with Sutter Health System, which is a huge health system, integrated health system in the Northern California area, which is enormous. We had the privilege of working with some really dynamic leaders early on when they launched their Office of Patient Experience to develop their advisory program, and a very robust program it is currently. I believe they have somewhere in the neighborhood of 24 advisory programs across their, what they call affiliates, their health centers, and 5 more coming on. So we've gotten the opportunity to see, how do you implement an integrated, large integrated system and then tie it together? And that's really the critical piece, is how do we leverage the opportunity to standardize some efforts and standardized materials and balance that with the local need for uptake and adaptation as is relevant to their local community. So we've learned a lot there with Sutter Health, and really appreciate that partnership. The LA County Department of Health Services, our first opportunity to work with a safety net health system here in the LA County, which is also enormous. And Lindsay spoke to it a little bit earlier, developing an advisory program and the infrastructure to support a community of learning around patient and family engagement and the value of that strategy. And this is, again, just a really innovative group of leaders promoting this effort. But I also have to say, through Lindsay's great efforts and others, the community of practice and the community of humble learners about how to meaningfully engage patients and families is just astounding there. Comagine Health, I have to say, is just such a fantastic partner. Formerly, they were called Health Insight, and way back when they were Health Insight and PFCCpartners was me, they jumped on board with the concepts early, and they showed me that intentionality to a longer term goal, short term and long term. And they now, they implemented in their organization, which is primarily a quality improvement organization, they implemented a patient family advisory council, and they made a pathway at the start of that effort for those advisors to join the board of directors, and they have done so. So just an incredible innovator. And then more recently, our partnerships with Acumen and Quality Insights, being 2 measure developers who are looking and learning with us about how we can effectively partner patients and families with, oh, did I go through? No, in the measurement activities. So Lindsay, you have coached hundreds of teams who are putting in and implementing patient family advisory programs. What are the main pain points that you hear, whether it's, again, research or health systems, hospitals? What do you hear as the main pain points?
Yeah, that's a great question, Libby. And there's really two that come to the top of my mind, especially recently in our work with Los Angeles County. The first being kind of the red tape in developing a patient family advisory program. Typically, new patient family advisors will go through a volunteer onboarding process, but that entails a background check, live scan, and a lot of other unnecessary processes for a patient family advisor. So implementing a new program with some of that red tape that the system presents can be difficult, but what we've seen that's worked really well is part of what we've been talking a lot about is developing that infrastructure, but bringing in all of those key players and key stakeholders within the organization to help support you making changes that will in turn benefit the growth of patient family advisory programs. Um, the other big one is always, I hear it constantly, but recruitment of patient family advisors. It is the biggest effort, the biggest amount of time that you need to spend when you're developing an advisory program, but the most important part. And so what we talk to teams about is just that continuous recruitment effort. Recruitment never stops, even once you have a good set of patient family advisors joining you and partnering. That recruitment never ends. But the biggest item, the biggest kind of gold star standard is casting that wide net for recruitment. So covering all of your bases, having your recruitment information in waiting rooms, connecting with staff to help support recruitment efforts as well, and finally connecting with community-based organizations and making more community connections that can also in turn support your recruitment efforts. So those are the two big ones that I've seen, but recruitment by far kind of takes the cake with the
Yes,
challenges.
definitely, definitely. But moving away from that selection process is
Yes,
really getting us closer to our diversity goals.
exactly.
Great. Well, I want to give a shout out to our sustaining partners. We work with each of these health systems to integrate effective patient-family engagement practices, and we work with each of them very differently, I would say. One of our newer partners is the Rady Children's Institute for Genomic Medicine, so we're developing patient-family input on some of those really critical ethical decisions around genomic medicine. Also want to give out a shout out to Memorial Care, who's been with us since the very beginning. But we value all of our sustaining partners and work really hard with them to implement and make sure they're leveraging the strategy of patients and families. There's a couple of examples of how we're involved in research teams. We've been involved in 4 PCORI-funded research teams and currently are an engagement award E for the PFA Summit. Also currently working on a National Academy of Science Catalyst Award, partnering in the intensive care unit communication here in LA County. I'm going to speed up a little bit because we have so much more and not very much more time. The PFA network, as I mentioned, was launched in 2012 or stumbled over the start line with 3 goals in mind: to create that sense of fellowship of community, to exchange skills. We kind of shied away from training because it really isn't training. It's not us training other people. It's providing an opportunity for all of us to learn together. And so that skills exchange is really important. And then finally, engagement. And we have become somewhat of a matchmaker in the environment. And so we're able to connect advisors who are interested in working regionally, statewide, and nationally to health systems and policy and organizations who are seeking that level of engagement. So we get to do a little bit of matchmaking. You see there a heat map of our advisors. There are over 600 of folks registered, receiving our emails and online. We have a smaller community of about 185 at last count, folks that have given us additional information and really want to participate in those engagement opportunities. Over the last couple of years, we have provided those trainings or skills exchange programs to over 360 advisors in a variety of different topics, and I'm really excited about that. We've connected 43 advisors to engagement opportunities. That's a little bit of a misnomer. We have often what we call open calls, and we'll just put out to everyone in the network if they want to complete a survey or be interviewed or whatnot, and we don't always track those. These are the engagement opportunities that we're actually making the connection and doing some preparation for. So some of the current health system priorities, and we're seeing these largely, again, across healthcare settings and across healthcare activities. Jumping out at me is health equity and safety, and I think those two are largely connected in so many ways. But the point here is that regardless of sort of where we are, which of these priorities we're focused on, we can engage the patient family voice to help us understand how do we get to health equity. First, we have to understand the problem, and I think we've come a long way in that, but we still have more to learn from people, from patients and families and community members themselves. We haven't come close to leveraging engagement as an active strategy for defeating any safety concerns in our healthcare system. We've come a long way. We've got some great leaders in Natasha Washington and Kelly Goodson and others who are really leading this work. We need to follow them and really continue to raise the capacity. So what's next? I'm going to really quickly go through these. We need to continue to raise the diverse perspectives. I just finished Melinda Gates' book, The Moment of Lift, and what she says is diversity is the solution to our equity problems. And I think that's absolutely so true. Until we have diverse voices at the table, we're not going to be able to create policies that are going to engage them. So continuing to expand our reach in every facet of that term. I love this shot. This is where we're headed. The sky's the limit in terms of how we implement partnership as a strategy for improvement. I think one of the other important keys moving forward is that we do need to be integrated into budgets. These patient family advisory efforts are not necessarily free, neither in staff time or advisor time. We have a thoughtful group working on this, and much more conversation to come on the way that we get integrated. But in my mind, having a line item in an administrative budget that says patient family engagement activities says we're hardwired into the culture. It's really hard to feel, I think, impossible to be hardwired into the culture of the health system without being hardwired into the budgets. The other thing we really need to be looking forward to is how do we inform the general public of their new opportunity in healthcare to be engaged in their care. So we've done all this work to help clinicians and health systems to engage the patient-family voice, but I worry that that gets expressed in the clinical relationship in terms of a physician, well-meaning physician attempting shared decision-making, but the person, the patient, is not prepared to do that. And it's like, well, why are you asking me what my priorities are? Where does this come from, right? So we need to expand the opportunity of the general public has to play in their own care. We need additional training and skills development. And I think one of the things that I really appreciate about the PFA network is they're so generous in letting us know what's needed next. And I think our opportunity as the staff at PFCC Partners is to be responsive to that. And so you'll frequently hear, and Lindsay's probably sick of me saying this, but all of our training programs have the handprints of hundreds of patient family advisors. All of you out there in the field doing the work, learning the hard way, and bringing those lessons back so that the community as a whole can really learn them. We're just simply a vehicle for those. And I look forward to future opportunities as well. And then creating the connections. I often describe myself as a giant Lego, and I really feel like I, as a patient and a family member, I cross all health settings, right? I cross into health policy, and I have an opportunity. I'm even looking at it even stronger than that now. I used to say I have an opportunity to bring people together. I have a responsibility to bring people together and make connections of traditionally unpartnered people or untethered people. This is a photo of me having the opportunity to bring together CMS and PCORI in a meeting, and that this particular area of CMS had not partnered with PCORI before. And so just to be able to bring together my connections, we all as patients and families have the opportunity, and again, I'm looking at it as my responsibility to do so. And then continue to build the evidence. PFCC Partners will likely not become a frontline research firm, but we will be here to partner with those who have expertise in research to continue to build the evidence case for patient and family-centered care. So Lindsay, I think I'm going to turn it back to you for some final announcements, and hopefully we might leave just a smidge of time for any questions.
Yes, we will leave a smidge of time. And there's a good question from Greg in the chat that we'll come back to as well. So just a few really quick announcements of some upcoming PFCC Partners activities. First, next Tuesday, the 28th, we will all be at the PFA Summit in Washington, D.C. at the new National Quality Forum offices. We will be joined by patient family advisors and some national partners as well for a day of learning together, brainstorming, and creating action items to move forward patient-family engagement and measurement. We really appreciate our partners, National Quality Forum and Discern Health, for helping us plan and put on this event. And I encourage all of you to stay in touch and in tune for outcomes, continuing the conversation of patient-family engagement and measurement. And then please save the date for our 10th annual PFCC conference. I'm sure that's crazy to hear, Libby.
Yes.
In the 10th year, we are expanding the conference to 2 days, which we haven't done before. There is just so much great work out there that we want to highlight and share. Requests for proposals will be out in, I think, the next month or so. In the next few weeks, we'll have the request for proposals out, and encourage all of you to submit a proposal to share your incredible work that you're doing as well. Aside from breakout sessions from those proposals, we will also have a lot of opportunity for co-learning workshops. So workshops presented by our team at PFCC Partners and other to help build your skills in patient-family centered care. So mark your calendar. We will have requests for proposals out soon, and also the registration out soon. And other ways you can stay involved with us: continue to join the monthly workshops. We have a great lineup for the rest of the year. So please continue joining us. All patient family advisors join the PFA network. Join us at the PFCC conference. If your health system or hospital or healthcare organization is interested in becoming a sustaining partner, we have some more information on our website. So highly recommend that to get more involved with us. And finally, stay connected with us through the mailing list and social media. You can find both PFCC Partners and the PFA Network on pretty much all social media sites. And with that,
well done, Lindsay.
Woo! We have 2 minutes.
All right. So I noticed Greg's question, I think food for thought more so, regarding research. And so we also, this year, in the last 18 months, are partnering with 2 National Institute of Aging research projects where we are developing advisory programs for those research projects. So I do think we're getting spread beyond PCORI, and I think, again, we can be those you know, mobile people disseminating those efforts. Anybody want to come off mute and ask a question?
Sorry, Libby, did you ask me a question?
No, I was just saying if anyone wanted to come off mute and ask a question or had a comment.
Did you see Barbara's comment in the chat? The PFCC journey achievements are so impressive in the model for mission-driven organizations. Have we or anyone written about this? White papers, journals?
If I could, I would dip down to show you my years of journals. So yes, I've written extensively on it. But not published anything, no. All right. Well, I want to thank everybody for joining us today and hearing a little bit about our journey. It's a pleasure to share it with you. And, you know, again, for those of you who have been on this journey with us, thank you. We can't do it without you. And for those of you who might be new to our organization, please join us. We need all the voices and the partnership from all different stakeholders across the health system to join us. So we look forward to more continued conversation.